Webinar number 5, LMS Research, one of my favorite topics. Be skeptical. Cancer patients are so vulnerable to being taken by false promises of a cure. So the old saying is true, if it sounds too good to be true, it probably isn't. Okay, so some ways to avoid some scams. Look for red flags. If it promises a quick or painless cure, they claim the product is from a secret or special or ancient formula. They use statements or unproven case histories from so-called satisfied patients. They claim to be a cure for a wide range of ailments. They claim to cure a disease that hasn't been cured by medical science, promise a no-risk money-back guarantee, offer an additional free gift or a large amount of the product as a special promotion, require advance payment, or claim there is a limited supply of the product. Beware. So the way to find real empirical research on leiomyosarcoma is to search PubMed. It's pubmed.gov. This is the U.S. National Library of Medicine by the National Institute of Health. It's empirically and evidence-based. Consider the source of the information by other doctors and researchers. It includes case studies, lab research, and clinical trial results. And this is information published in leading scientific journals. And don't forget our old friend Google. I Google up doctors, I Google up names of drugs, I Google up clinical trials, I Google everything. Google can be your best friend. Okay, so when you look at research, there's several different types. First is a case study, and that's about a single patient. So those aren't very useful. It's interesting, but not useful for the majority of us. Then there's reviews of the literature. Then there's clinical trial results. And the last one is the best, meta-analysis studies. So what those do is they look at all the studies done, and they use a statistical procedure for combining the data. So it looks at all, and it develops one single conclusion. A lot of research studies have what they call an abstract, and that's kind of a summary or a short, quick take on what the study was all about. So first it lists the title, the authors, the publication, and date. Then a little background, why they're doing the study. Then the methods they used, the actual data or results, and then their conclusion. So you want to know a little bit about research talk. So here are some abbreviations. So when you're reading those abstracts and those research reports, you want to remember what these symbols mean. CR, complete response, means the tumor was destroyed. Partial response, some shrinkage, maybe in some tumors. Stable disease, no growth, no shrinkage. Progression-free survival, how long before they did see growth, and overall survival. And when you see a number in parentheses, that's the actual number of patients. Okay, so the devil's in the details. Beware of studies that lump all sarcomas together. Each sarcoma is very different from each other. They all respond differently to chemos. So you want to look for specific data on the LMS patients in those studies. How many patients were in the study? The more the better. What was the response rate versus the overall survival rate? And what are they comparing in terms of drugs? Are they comparing a high-functioning drug or a low-functioning drug to the new drug? You should also become familiar with the NCCN guidelines. These are the guidelines that your doctor follows. You can find them online. There's also a patient version. But this is the standard of care that doctors follow. There's one for soft tissue sarcomas, and there's another one for gynecological cancers, which they have uterine LMS under. These get updated every few years. And of course, when it comes to research, I'm going to tell you to participate. We have an LMS tissue bank that was started in 2005 by LMS patients in our online support group. It's housed at Stanford Medical Center. We have 500 paraffin blocks to date. Along with that is the patient history. Many publications have been made looking at these tissue blocks, and it's been borrowed by over 10 researchers, and we're still collecting. So to see how you can donate a tissue block, go to our website. The other thing we started in 2015 was a partnership with Cords at Stanford, and that's an LMS specific questionnaire that our own medical advisory members came up with, and there's ongoing enrollment in that too. If you enroll in this registry, it is a way for people who have new clinical trials to contact you, as well as people who can study just the demographics of people with LMS. We now have some promising new research on the horizon. LMS-DR was created to help fund research. When I started off as a patient in 2002, there was hardly any research at all for LMS. Now there is a lot more for you guys. So one is the LMS circulating DNA being done at Stanford. Another one is they're looking for a marker to find out who would respond to Trabectedin or Yondelis. And then we have the $1 Million International Collaborative, which you can read about on our website. So here's the summary. Avoid scams by seeking out scientific empirical evidence instead. Read published research articles in PubMed. Look carefully at methods and results of an abstract summary. Meta-analysis combines the data from multiple studies. That is the highest quality study you can read. The NCCN guidelines are the standard of care for sarcoma doctors. Participate in LMS research by donating a paraffin block to our tissue bank. Participate in LMS research by joining our LMS registry. LMSR is helping to fund promising new research. We need your help.